Welcome back. While much has been made of this infamous moment at the Oscars, what often gets lost in the story is something thousands of women struggle with every year, and that is hair loss.
A joke about Jada Pinkett Smith, who had recently shared the reason behind her bald head, pulling back the curtain on her battle with alopecia. This morning, we want to talk to more information about a journey that causes so many to suffer in silence and shame.
Dr. Ben Stong is here with expert advice for us. Good morning, doctor. Good to see you. This is a topic that is of interest to so many, and it is National Hair Loss Awareness Month. We mentioned Jada Pinkett Smith's journey, but what is the biggest cause of hair loss in women, and is it different for men?
Well, female pattern hair loss is exactly the same mechanism as it is in male hair loss. It's just less common. It's related to a genetic sensitivity passed down from your ancestors to a byproduct of testosterone breakdown, and women have testosterone just like men do, and it's called DHT, and it causes the hair loss.
So you're a plastic surgeon. What are some of the solutions for people experiencing this hair loss that you can help with?
Yeah, there's a limited number of medical treatments for hair loss. Minoxidil over the counter is very common. It works effectively. Finasteride, mainly in males, because it can cause birth defects in females. But PRP with ACell, which is basically platelet-rich plasma. It's your own blood product taken and then re-injected into the scalp to help reverse the hair loss process. And that's really the gold standard for non-surgical hair loss.
So people at home are listening to this. Explain that one a little bit more, because maybe it's not something they're familiar with. Sounds kind of painful, and what's involved in this, and how expensive is it?
Yeah, it's actually not very painful at all. It's just simply a blood draw. You get about 80 milliliters of blood drawn off. It's spun down in a centrifuge to separate out the red blood cells and white blood cells, and then you get basically concentrated plasma with your own platelets in it. We mix ACell into the PRP, which makes it work better. It's derived from a pig intestine, actually. It's just a stem cell stimulator. And then these about 7 milliliters of plasma are re-injected into your scalp. We recommend 4 treatments over a 1-year period, and they are roughly $1,500 per treatment.
So what about for those who, can prevent hair loss? Is there anything that we can do to keep it from happening to us if it's not genetic, like vitamins, diet, anything like that?
Those marginally help. Of course, there's vitamins specifically tailored towards hair loss, but if you have real significant hair, genetic hair loss, female pattern hair loss, male pattern hair loss, at some point you're most likely going to have to do some of these treatments in order to keep your hair. Some hair loss is natural. Your hair falls out, and then you have hairs that turn on and start growing, so you don't lose density. But once you start seeing density loss, that's the time to start treatment. Finasteride is actually the best thing you can actually do for hair loss. It's a blocker of that DHT at the hair root level, but we can't really use it in females, at least in childbearing years, because of its teratogenic potential effects.
But you can use it after those years, because a lot of women lose hair during menopause too. So very interesting discussion, Dr. Ben Stong. We want to thank you so much for joining us this morning. We appreciate your time. Anita and I were talking earlier about how much hair falls out when we shower.
You get paranoid, yeah.
So
it's scary.
Yeah, it is.
Yeah.
Good
All right,
conversation.
thank you so much. We appreciate it.
Yeah, thanks for having me.